Good day. I am Christina Cassandra Cesar, your student nurse from BSN 111D, and today I will be demonstrating the procedures in taking vital signs. Measuring the accurate vital sign of the client allows us to track changes in client's condition, as well as it reflects the body's basic functioning. Vital signs include temperature, pulse rate, respiration rate, and blood pressure. So now I'm going to start by taking my patient's body temperature. Body temperature reflects the balance between the heat produced and the heat lost from the body. So prior to performing the procedure, introduce self to the client and verify her identity using the agency protocol. Explain the procedure to the client and how she can participate during the assessment. Good day, ma'am. I am Christina Cassandra Cesar, your student nurse. And may I see your wristband po, ma'am? Can you please state your name?
Nationality Batangas.
And what's your birthday, please?
April 9, 2004.
Thank you. So today, ma'am, I'm going to get your temperature, so just relax, okay? This is to obtain necessary data from the client, and when the patient knows what is to be done, she will cooperate better. Next, I'm going to perform hand hygiene with the use of alcohol. This is to deter the spread of microorganisms. Next is to provide clients privacy. Also, I will position the client appropriately. This is because proper positioning ensures visualization and also flexing knee relaxes muscles for ease of insertion. I will also wipe the tip of the thermometer with an alcohol swab in a firm twisting motion prior to placement. So this twisting helps to come in contact with the thermometer's entire surface. Then, I'm going to move sleeve away from the arm and shoulder. Next, pat the axilla joint only if it is very moist, and place the tip of the thermometer in the center of axilla and ask the client to lay the arm over the tip and across chest. And then I'm going to turn the thermometer on. So ma'am, can I pull your sleeves up? I'm going to put the thermometer, ma'am, okay? This is because moisture in the axilla may alter the result of the temperature. The deepest area of the axilla provides the most accurate temperature measurement. I will leave the thermometer in place until signal or beep is heard. Allowing sufficient time for the axillary tissue to come in contact with the thermometer bulb results in a reasonably accurate measurement of body temperature. And now I'm going to remove the thermometer and tell the client's temperature. So ma'am, your body temperature is 36.5 degrees Celsius, which belongs to the normal range. Then I'm going to wipe the tip with an alcohol swab from stem to the thermometer sensor in a firm twisting motion and perform hand hygiene. This is all to deter the spread of microorganisms. Next, we check the temperature if the temperature is obviously too high or too low or inconsistent with the client's. This is to prevent an incorrect temperature reading. And now I'm going to document the temperature in the client's record in a TPR sheet. So this is to take note of the findings as a record. So now, I am going to proceed in taking my patient's pulse rate. The pulse is a wave of blood created by contraction of the left ventricle of the heart. So since I already introduced myself to the client and verified her, I will directly explain the procedure to the client and how she can participate during the assessment. Good day, ma'am. Today I'll be getting your pulse rate book. So just relax, okay? Next, I am going to perform hand hygiene with the use of alcohol and provides for client privacy. Now, I will assist first the client to a comfortable supine position. And then, placing my client's armrest alongside of her body. I will select the pulse point. Normally, the radial pulse is taken. Now, I will palpate, placing the first two fingers over the thumb side of the client's inner wrist. If the thumb is used to palpate the patient's pulse, the nurse may feel her own pulse. That's why we need these two fingers to palpate the radial pulse. And then I will count for 1 full minute using the wristwatch. So sufficient time is necessary to detect irregularities or other defects. Aside from taking her beats per minute, I need also to assess her volume, and aside from that, I will also check her rhythm if it is regular or irregular. So ma'am, your pulse rate in supine position is 88 beats per minute, which belongs to the normal range, and its rhythm is regular. And now, if the pulse rate is abnormal, repeat the counting to determine accurately the pulse rate, and then document the pulse rate, rhythm, and volume in the client's record in the TPR sheet. Now, I'm going to assist my client in a sitting position. I will bend client's elbow to a 90-degree angle and support the lower arm. This position places the radial artery on the inner aspect of the patient's wrist. Follow the same procedure in taking patient's pulse rate, but this time in sitting position. We need to dictate her pulse rate for one full minute. So after counting my patient's pulse rate for one full minute, I will tell her her pulse rate. So ma'am, your pulse rate in that sitting position is 98 beats per minute, which belongs to the normal range, and also its rhythm is regular. And now I will perform hand hygiene. Lastly, I'm going to record and document the pulse rate, rhythm, and volume in the client record in the TPR sheet. record the client's abnormal skin color and temperature if observed. So now, I am going to proceed by taking her respiration rate. Respiration is simply the act of breathing. It is usually done when the person is at rest and by just simply counting the number of rising of the chest of the patient. So since I already introduced myself to the client and verified her, I will directly explain the procedure to the client and how she can participate during the assessment. So ma'am, today I'm going to get your respiration rate. So just relax, okay? Next, I'm going to perform hand hygiene with the use of alcohol and also provide for client privacy. So using a wristwatch with the second hand, I will count the number of respiration for 1 full minute. While doing this, I will determine the depth of her breathing if it is labored or unlabored, rhythm if it is regular or irregular, and for the character. So ma'am, can you please put your hands on your chest? And then I'm going to count for 1 full minute. So ma'am, your respiration rate is 17 beats per minute, which belongs to the normal range for your age, and its depth is unlabored and the rhythm is regular. A complete cycle of inspiration and expiration constitutes one act of respiration. Sufficient time is necessary to observe rate, depth, and other characteristics. And now I'm going to perform hand hygiene and document the respiration rate, depth, rhythm, and character on the TPR sheet, which I already did earlier. So, lastly, I am going to determine my patient's blood pressure. Blood pressure is a measure of the pressure exerted by the blood as it flows through the arteries. Paraphernalias needed are stethoscope and sphygmomanometer. So since I already introduced myself to the client and verified her, I will directly explain the procedure to the client and how she can participate during the assessment. So ma'am, lastly, I will be getting your blood pressure. So just relax and sit back and just relax, okay? So next, I'm going to perform hand hygiene with the use of alcohol before doing the procedure. And then provide for client privacy. First is to ensure that the equipment is intact and functioning properly. Check for cuff size and leaks in the tubing between the cuff and the sphygmomanometer. Using a faulty equipment or cuff that's too large or too small can give you inaccurate blood pressure readings. After that, I will make sure that the client has not smoked a cigarette, ingested beverages that contains caffeine, or has had any strenuous activities within 30 minutes. So ma'am, prior to this assessment, have you performed any exercises or drink beverages? Okay, thank you. Then I will determine the best arm or side to use. So it's best to take blood pressure in the non-dominant hand, which is the left if the patient is right-handed. And then I will position the client appropriately. The adult client should be sitting, both feet should be flat on the floor, and the elbow should be slightly flexed. So this position exposes the brachial artery so that a stethoscope can rest on it. So we need to position it properly so that the stethoscope can rest on it conveniently on the antecubital area. Now I'm going to move sleeve away from arm and shoulder and wrap the deflated cuff. And then I'm going to locate the brachial artery and apply the center of the bladder directly over the artery. So ma'am, can I pull up your sleeves? So the pressure applied directly to the artery will yield most accurate readings. So I will use my fingertips to feel the strong pulsation in the antecubital space. Accurate blood pressure reading is possible when the stethoscope is directly over the artery. Then I'm going to position the stethoscope appropriately by using the bell of the stethoscope. I will then auscultate the client's blood pressure. So the first sound is the systolic BP and the second sound is the diastolic BP. So ma'am, your blood pressure is 110/80, which belongs to the normal range. Next, I'm going to remove the cuff from the client's arm. And then I'm going to perform hand hygiene. Now, I will then document and report the patient's result in a TPR sheet. So now, that's it, and we're done obtaining all the vital signs needed. So that's all, and thank you for watching.